brought up something that I wanted to come back to, immediate loading, and sometimes you don't immediately load. Immediately loading means you actually screw an abutment and the prosthesis into the implant that was just placed, and that doesn't usually happen on single crowns. He's talking about if he placed sometimes a prosthesis and you place 6 implants, sometimes you might only load 4 during the healing stage.
Sometimes nothing.
Sometimes nothing.
Sometimes nothing. Sometimes okay. And I always tell the patient, even before the surgery, when I see the condition of the jaw, maybe you are not one of those, but sometimes it happens. Bone is not that great. We need to put the implant and graft, and the implant definitely are not in a very sturdy position or strong position to have an immediate loading, which is this bridge that we install the second day. Sometimes, I can see it obvious from the beginning. I'm telling you, we are removing the teeth, placing the implant, and we give you a denture. Yes, this bad one that everybody hates, for about 4 months or so until the implant heals. Or I would tell them I have 50-50 chance for that can happen. If I don't feel the implant are good, strong enough inside the bone while insertion, I might have to give you a denture. Or if it helped me out, I will give you the bridge. You just need to be upfront with the patient about this particular piece before the surgery. Yeah. The patient really doesn't want to wake up from the IV sedation and tell, hey, you have a denture. No.
Right.
From the beginning, from the consultation time, there is a chance that might happen.
Yeah.
So we don't want to discuss this while you're in the chair at the surgery. I'm telling you from now, it might happen.
How many times, and I know, I mean, the next day after our surgery, I remembered as I was watching it again last night, preparing for today. That was fun. But you had a double the next day. You had 2 upper and lowers the next day. So 4 arches.
That's, yeah, but relatively simple. You can't really do 4 arches in one day unless they are relatively simple.
I mean, that's pretty intense.
It is, yeah.
And so, but in that process, when you have the ability, you've done a lot of these, how many of those end up being, they go home in a denture? And I think this is good, it's real, it's not salesy. I mean, this
and
is
by the
something...
way, sometimes the upper is denture, we do upper and lower, right?
Yeah.
Sometimes the upper just denture, the lower is fixed, right?
Okay.
It just, the lower jaw was in a better condition bone-wise than the upper, so patient can go second day with upper denture and lower fixed bridge, right? Yeah. It's again, it happens every now and then. I would say 5% maybe can happen this way, 10% can happen this way. You just can't really tell exactly how many. It depends. Like, it's case by case thing.